You said that. It's not nice. It's not nice at all.
I did not say that looking at you. I just said this is the Crooked Nose podcast because we're talking about crooked noses today.
We are indeed. Yes,
do you have a crooked nose? Is that the issue?
No, I just have this.
Is there something you want to get off your chest?
Septum that you're going to have to fix one day.
When it becomes too much.
Yes, but we're not there yet.
No, you're good. Your nose is fine. Your septum's fine. Everybody's fine, except I deal with crooked noses all the time.
Yes, you do. That is exactly your specialty.
You know, we had Megan, our patient, on about crooked noses, and she had a very crooked nose. And we kind of went through it on that podcast, but I thought we should dedicate an entire session to how you approach crooked noses, why they're crooked, and what the results, what you can expect from a repair.
Right. Well, let's define what a crooked nose is. So someone like me, say, has a deviated septum, and if I take a photo at the right angle, I can kind of see that my nose slants to one side a little bit. But that's not what you're talking about necessarily.
Well, it is. I mean, crooked comes in a lot of shapes and sizes. Yeah. There's a spectrum. The nose can be crooked from you were born that way, from trauma, from previous surgery, from having something happen internally that you can have a septoplasty that actually affects the outside of the nose and can make the nose itself crooked. And typically you see some sort of swagger to the nose. It curves. You have a C shape to it. It can go both ways and be sort of S-shaped. It can have all kinds of crookedness to it. But also there's the concept too where the nose itself may, if you were to take it off the face, put it on the wall, it'd be like, oh, that's a great looking nose, except that the way that it sits on the face, it sits crooked. So the nose itself isn't actually having problems. It's that it's kind of canted on the face in an odd way.
Got it. So what do you do for these patients?
Well, again, first things first, make a diagnosis. Why is the nose crooked? And a lot of times what will happen is patients will come in and say, well, I have to take a picture a certain way or my nose looks so crooked. And they've found like the right selfie angle that
it's all about the angle.
They just kind of and wait, okay, now. And then they get that shot and it's perfect. But it really is about the whether the middle vault, the bones, or the tip is twisted or off kilter, or, if, again, the whole base is to the side. So let's start with kind of the bones got broken and it's going the wrong direction. And that happens a lot.
That happens a lot.
Your nose is sitting out in space and it's easy to,
get
whack
whacked.
It with something.
Many things.
There's the traditional, right hook to the face. There's the poor soccer mom sitting in the stands who takes a full, volley soccer ball straight to the face, which happens way more than people would like to believe. There's the walking in the night, going to the bathroom, and the door is open just a little bit, and you walk straight into the edge of the door and smash your nose. These things can all break the bones and the middle vault. And the middle vault is something we'll get into, but the bones are what you see on an x-ray.
The bones are not actually what make up the entirety of the nose. If you look at an x-ray, you'd be very surprised to find out how kind of small the nasal bones are in comparison to the rest of the nose. They really are just that top third of the nose. So when you say you've broken your nasal bones, you haven't really broken the whole nose. You've just broken the top third. But you break it on one side or the other, it can definitely give your nose either a depression in that area or an actual cant to one direction.
For sure. And this is one of the things in medicine that drives me bananas, is they get an x-ray in the ER, they go, well, your nose isn't broken because the bones haven't been broken. In the meantime, the cartilage is totally mangled and you've shattered the septum and smashed the tip. And the ER doc, bless their heart, they say, well, you didn't break it. Well, you did.
But you did.
But you didn't break the nasal bones. And the bones can be very short.
Yeah.
And in Jack Sheen's book of aesthetic rhinoplasty, Jack Sheen 1, he goes through the bones can be short, medium, or long, and they can be thin, medium, or thick. And that's kind of the classification that I kind of use too, because again, you said, these bones look really small unless